I'm Diana and I work for OCD UK, and I had OCD for 26 years. My earliest memories of the illness were when I was probably about 8 years old. The symptoms then were a fear of stepping on the cracks, and I don't know why this was, but it obviously made me feel physically uncomfortable if I did do that. So that was one ritual. Another ritual, which is the compulsion, is that I used to have a great fear that if I didn't say my prayers so respectfully and sincerely, that my mother might be killed in a car accident. And it's taking on this huge responsibility as a child for another person's life. A lot of people know about the hand washing and the checking, but a lot of people are unaware that OCD can also take in a rather sinister angle where you can have a fear that you may harm very violently your own children, and it is the most horrific thing to go through. When I had my fourth child, I used to have intrusive thoughts, and when I used to go to bed, that I would go to the children's bedrooms in my sleep, take out their dressing gown cords and strangle each one. And this was the most horrendous thing to have to go through, because I didn't know whether I was going to do it or not. I was permanently exhausted. So that was the obsession, but the compulsion was to try and relieve some of the pain and the terror that I was going through because of the thoughts, was to get out of bed, go and find their dressing gowns, take their dressing gown cords out of their dressing gowns, tie the cords in as many knots as possible, thinking I won't be able to actually put the cords around their necks. And then I'd go back to bed and I still couldn't sleep, and so I would have to get out of bed again, get the dressing gown cords, put them into a bag, seal the bag, put the bag in a high cupboard, and again this would give a little bit of relief, but it was still terrifying. People with OCD are not dangerous and they do not harm, but you cannot get over this alone. You must go and speak about these ghastly thoughts to somebody. After I'd seen my doctor, I saw a very, very good consultant psychiatrist, and I was put on antidepressants, which helped me enormously. I had the medication combined with CBT. The antidepressants gave me the strength to sleep and eat well, so that I could then have my cognitive behavioural therapy, which is a psychological treatment. It deals with the here and now, and it doesn't go into your past, doesn't focus on your childhood. And it's the most wonderful treatment. So with the antidepressants and the cognitive behavioural therapy, I was able to put my heart and soul into my own recovery. I often used to say to myself, what is wrong with my memory? Why can't I remember whether the gas has been turned off? Because I would have checked 13, 14, 15 times, and I only checked 10 seconds ago, but still I'd be saying to myself, what is wrong with my memory? Well, in fact, people with OCD, they have a perfectly accurate memory, but what we don't have is a competent memory, and this is where CBT can come in and help restore that. I run a support group in East Sussex, and I find that they're actually very powerful, and it's wonderful to see people coming together and perhaps for the first time ever talking about, disclosing their inner thoughts that they've had hidden for years and years. I think support groups are very powerful, and for some people being able to meet someone else with the condition gives great relief, and immediately there's a bond there. You can talk about things, share the thoughts that you've had, and also talk about just your own experiences. And I'm just so grateful that I had a very, very good psychiatrist, and I had enormous support. I feel less tired because I was perpetually exhausted. I can now enjoy my days, and if I have an inappropriate thought, I can dismiss it by thinking, this is OCD, and no, it's just a thought. There is so much help out there, and there is good help. Things are improving all the time.